Good afternoon, everybody. And I'll start by giving an update on our cases here in Nova Scotia. So as the Premier said, as of today, we have 3 active cases of COVID-19, and our total numbers are, we've had 1,086 cases of COVID-19 so far in Nova Scotia. We've had 81,092 people tested with negative results, and we've had 65 deaths, unfortunately. Yesterday, the Nova Scotia Health Authority's lab completed 801 tests. And since we were briefing last Friday, we have announced one new positive case of COVID-19 that was announced on Monday, and I'm going to explain that case in a bit more detail. Anytime we announce a case, we need to balance providing details for the public with the individual's privacy. But I feel it's important to provide some more details around this case because the individual is a home care nurse in the central region, and there's been a number of communications about this in the public already. This person had COVID several months ago and recovered. That's why this test required much more investigation from public health in collaboration with our laboratory colleagues. The individual's test results have been inconclusive, and we are working with our local lab and the national lab to determine whether this is a true case of reinfection or not. In the meantime, out of an abundance of caution, we are assuming that this is a new positive case and taking the appropriate public health measures. We do not want to wait. We can't wait to get the final question or answer from the lab, whether we ever get that or not. We have to make decisions and take timely action, and we're always erring on the side of caution. We know that this individual wore full personal protective equipment and followed the appropriate infection controls while working. And public health has been following up household and close social contacts, and we have been working with the home care agency, assessing each home care client and what was done in the home for that individual to determine their risk of exposure. And appropriate actions will be taken for each client based on these individual assessments. I want to remind people that we updated the list of COVID symptoms on Friday. People should contact 811 for assessment, and preferably, if you're able to, do it online. If you're not able to do it online, call 811. But they should contact for assessment if they develop a new fever. And often that people don't have a thermometer, but if they have chills or sweats. So if you develop a fever, that's the first symptom, or a new or worsening cough, or 2 or more of the following symptoms if the symptoms are new or worsening of chronic symptoms: sore throat, runny nose or nasal congestion, headache, or shortness of breath. We have refined that symptom list from our broader symptom list. Simply as we got more experience with the broader symptom list, we understood how people were presenting with COVID, and we're very comfortable with this much more refined list, which is close to where we started at the very beginning of COVID. So all that is that symptom list is part of our information that's on our online coronavirus website. But it's important that anybody who's having those symptoms do the online contact 811 and get further direction from 811. I'd like to move on to an update on post-secondary education, as the Premier touched on. Over the past number of weeks, we've been welcoming University and Nova Scotia Community College students into the province to start or continue their studies. And I know that some Nova Scotians have been worried about so many people coming into the province at once, especially from outside the Atlantic bubble. That's why we worked with universities and the community college to put plans in place to welcome students back to campuses safely. And based on information from the universities and the discussions I and my public health colleagues have had with them, I'm pleased to report that it has been going well. As the Premier noted, about 3,200 students have entered the province or have entered Nova Scotia from outside the Atlantic Canada. And for the most part, they are doing or have completed their 14 days of self-isolation and their COVID-19 tests. Compliance with the digital check-in is very good. And the fact that we have only had 3 cases among the first 3,200 students bodes well. That's good news for all of us. So it's good news in 2 ways. It shows that the risk from students is relatively low, but it also shows that our strategy has worked, because we had 3 individuals who, without the measures in place, could well have been following a normal student life and having much more significant potential exposures here in Nova Scotia. I want to thank students for their cooperation with these important public health measures. And I know that it's been a very different university or college experience for you so far, but students have taken on a broad responsibility to each other, to their institution, and to the wider community that is hosting them during their time educational time here in Nova Scotia. For the small minority that isn't doing this or isn't doing what they're supposed to do, I ask them to please think about the potential impact on their friends, their neighbors, their fellow students in the university, and the general community that they are now part of. It's very important that we all do what we can do to keep each other safe. I was made aware of a very long outside lineup at a Halifax bar on the weekend, and very clearly by the pictures there, people were not practicing physical distancing. This is very concerning for all of us, or should be concerning for all of us. Is very concerning to me, because we know facilities like bars are high-risk environments. This has been demonstrated yesterday by the decision in British Columbia, based on their epidemiology, that they have closed down nightclubs and supper clubs because of the important contribution that they were making to the spread of COVID-19 in that province. Safety in what I'm going to call entertainment establishments is everyone's responsibility. Our restaurants and licensed establishments have clear guidelines that they must follow to operate safely, and we have enforcement and inspection on the ground in these facilities. But patrons also have to take responsibility for their own behavior and how it impacts others. As the fall term gets underway at our post-secondary institutions, it's very important that all of us, students who we welcome into our communities, as well as ongoing community members, continue to practice all the personal protective measures. We need to socialize, but socialize safely, in small groups, no more than 10, and keeping that group of 10 as consistent as possible. If people go out to a bar, you need to respect physical distancing in the bar and in the lineup. You need to continue to wear masks as required, and wearing a mask does not mean you can forget about physical distancing. The two go together. They don't replace each other. As I said, I believe it's the minority who need this reminder. Much more often, we're hearing from students and about students who are trying to follow the rules. And I want to clarify a point that's come up a lot, that a lot of students are wondering how they can continue to self-isolate while they have roommates. The bottom line for them is they need to stay apart as much as possible and be vigilant about hand washing and cleaning. We have a lot more information on our coronavirus website, but a few key things is that they are not to have visitors. There are arrangements that they can make to have groceries and other essentials delivered. If possible, using separate bathrooms and keeping to their own bedroom. Not sharing personal items like toothbrushes, their own cups, etc. Trying to keep shared spaces like kitchens and bathrooms frequently cleaned, and as much as possible using windows and other forms of ventilation. And again, frequent cleaning of what I call commonly touched surfaces, door handles, light switches, etc., using a disinfecting cleaning. If they have a roommate who continues to self-isolate, but the student themselves is not, either because they are not required to or they have completed their isolation, then that student is able to leave their home and go about their business as usual, following all the other public health requirements, as long as they remain well. And even when even when all the self-isolation is finished, and for a lot of students it is coming to an end, it's important that students continue to remain focused on COVID safety throughout the upcoming school terms here in Nova Scotia. You will be establishing a regular routine, but it's not like previous university years. Our case numbers remain low right now, but we are still in a pandemic. We still need to remain vigilant, and we know that that for a number of factors, in terms of the age groups that we're seeing increased activity of COVID across the country, the social factors that often go with this age group, there are significant risks, and we need to all be careful, and we really need to work together, even while you're here for university. And socializing is part of that. Again, we need to socialize, but socialize safely. It's important that students understand this, and that our communities are doing what we can to support students in this. We all need to keep COVID-19 out of our communities. Then that is how we allow our communities to be safe. It's how we allow our educational institutions, which are and will remain a priority for us, whether they're universities or whether they're our public schools. It's how we allow them to remain open. Education is an important priority. And to do that, we all need to continue all the preventive measures. So I'll go through them yet again. That means wearing a mask where necessary, physical distancing where possible, following good hygiene and cough etiquette, and if people are unwell, they need to stay home and do an 811 assessment. It means not going to big parties or being in close contact with lots of people in social scenarios. There are other ways to socialize, but again, to socialize safely without creating high-risk situations. This is extremely important, not only to protect each other as students, but also to protect everyone in our communities, especially our most vulnerable populations. And speaking of vulnerable populations, I just want to talk a little bit about the long-term care designated caregivers that was announced yesterday. The pandemic has been particularly difficult for our long-term care residents, but they remain one of the highest risk group of severe consequences from COVID-19. So we need to continue to be extremely careful with these facilities and the residents. We have been able to, throughout the summer, gradually loosen visitor restrictions. We introduced first outdoor visiting, then expanded that and added indoor visiting. We have allowed residents to now go for off-site medical appointments. They're allowed to open things like hair salons, and we've in the recent past we've actually dealt with some of the liability concerns through the emergency measures to help support facilities to adopt these measures. But as announced yesterday and comes into effect September 11th, we are giving the ability now to have family members, a designated caregiver that could be a family member, to help care for and support their loved one in a long-term care facility. A designated caregiver can be a family member, a spouse, friend, or other support people. They must have an established caregiving relationship that was there prior to the pandemic. They can help with specific caregiving tasks like personal care, mobility, or help with eating. Individual long-term care facilities will work with residents, families, and substitute decision makers to identify up to 2 designated caregivers per resident. Only one designated caregiver can visit at a time, however. And these designated caregivers will be trained on the public health requirements, including how to wear a mask properly and safely, good hand and respiratory etiquette, or hand hygiene and respiratory etiquette, and the facilities that may be specific to each individual facility. We have to remember that these individuals are not doing more advanced care, so they don't need training in healthcare related infection control and personal protective equipment, but they'll have specific training on the very basics that they need to, hygiene measures that they need to follow to safely provide that care. Facilities will be providing medical masks for these such caregivers, and they will, each time they come into the facility, they'll go through appropriate COVID screening. And as I said, this will come into effect on September 11th. So in conclusion, as we head into the fall, I need to continue to ask everyone to care for each other, to keep our community safe by following all the public health measures that will allow us. We've been labeled the Atlantic provinces as the New Zealand of North America. So if we continue to do all the things that we are supposed to do, we can continue to remain in such a safe place. But it is incumbent upon all of us. Our low numbers don't mean we can ease up. We need to continue to wear masks, physical distance, practice good hand hygiene and cough etiquette, and staying home if we're unwell. These are the things that we need to focus on, and these are the things that will get us through safely the coming weeks and months.